So pelvic organ prolapse means your pelvic organs are falling from its place. What is the reason of pelvic organ prolapse? The reason can be weak pelvic floor. When your floor is weak and can't maintain the sustained pressure or compression across the canals. So this pelvic floor weakness and laxity into the pelvic floor can be the one reason. Second reason, the ligaments which is supporting the organs, they are weak. So during the pregnancy, we know that the whole uterus is going for relaxation. The large enlargement of the uterus is going to happen. So this is going to create a lot of stretching of the ligaments, which is attached with the uterus. And during this particular time, all the ligaments of the body are, or connective tissues of the body, they are weak because of the relaxing hormones. And lax ligaments, if the repair is not 100%, if healing is not 100% in postnatal time period, if female is involved into a lot of loading, pulling, pushing things, carrying things, and she start work very early, she's not giving her enough time to have a better healing. Normal 60 days time period should be there when she has to take enough rest. So these connective tissues can get healed. The tissues which is enlarged, the uterus, bladder, everything is enlarged due to that relaxing hormone. So they should settle down back into their normal position. But that requires rest and no unnecessary loading onto the organs. But if female is doing this poor, take care of her health and she's not taking enough rest and poor healing is there, so ligaments will not get completely healed, and the female might have a loose, weak or lax ligament which is supporting the organs. So if these ligaments are weak, so we can understand that patient can have a loose structure, because whatever things it is my responsibility as a ligament to hold the organ in a right position. But if I am loose, I will not be able to pull or hold or maintain the position of the organ. So that can be the reason. Third, bigger hiatus downwards. Urogenital hiatus is big, anorectal hiatus is big. So too much of looseness, the bigger openings are there. So center of gravity will pull the organs downward, either from the vagina or either from the rectum. So this can be another reason of the pelvic organ prolapse. So out of these three reasons now, or too much of straining during constipation, when patient is always putting strain, she has a constipation, she has avoiding difficulty, she's putting strain during that urination, she's putting strain during defecation, always strain is going on. So that load from the upside can also push the organ move down. So it will create a weakness, it will pressurize the organs to move down also. It will also be a reason of weakness into the pelvic floor. So this intra-abdominal pressure. So intra-abdominal pressure, gravity, the damage, the pregnancy, the childbirth, they all can, the hiatus, bigger hiatus during the childbirth, delivery, vaginal delivery, they all can be the reason of pelvic organ prolapse. Now, how many types of prolapse can be there? All these three organs can get prolapse, can come outside. So let's think that which organ is into the center. So center is vagina. So the prolapse is going to happen either from the vagina, or it can also happen from the rectum. So assume that we are talking about the vaginal prolapse. So how many prolapse, if you are inserting your finger inside or if you are looking at the orifice of the vagina, so what structures you can see from the vagina? So thinking about, it can be prolapse of the anterior wall of the vagina, prolapse of posterior wall of the vagina, that can be you can make it in a broad term, anterior wall prolapse. If you want to go in more detail, so anterior wall prolapse can be of three types. One is what organs, what structures are present anterior to the vagina. So now we have urethra. So assume that urethra is sagging down. It is falling downwards. So we call it as the structures around the urethra, the ligaments around the urethra, they are weak. If that is falling downward, we call it as a urethrosil. Urethra can fall downward in two ways. It can fall downward from this anterior wall. So you can insert your finger, you can see externally urethral prolapse. You can insert your finger and can feel urethra is prolapsing, or into vestibule itself, you can see the urethra is prolapsing down. So urethral prolapse can be visible into vestibule itself, and it can be palpable through vaginal palpations also. Or so this is a urethrosil, first prolapse. Second, the prolapse can happen of the bladder. Bladder is falling back. So we call it as a cystosil, bladder wall prolapse. Wall prolapse. Bladder is falling backward. So this is the second prolapse, urethral prolapse, bladder prolapse. Or we can say anterior wall. Anterior wall don't have tone. What happens? Every female, whenever we are getting pregnant, our whole uterus is going to expand up to the fundus into this 9th month. Now, whenever the uterus is expanding, so you see that uterus is attached with the anterior wall. So uterus is gonna pull the anterior wall upside. So throughout the 9th month, anterior wall is going for overstretching. So overstretching means all the rugae which is present into this anterior wall, they might get flattened because of this extra. This is a rugae. Can you see this circular bumps? So these rugae can get this high stretching effect for 6 months, and they might create a flattening of the rugae or lower tone into the vaginal tissue. So there might be weaker tone. If the vagina will not have a good tone, so it might start falling backward. So vagina anterior wall can start falling backward. Not the organs. It's not a cystosil. It's not a urethrosil. It is vagina which is falling backward. Okay. So this can be vaginal wall prolapse, anterior vaginal wall prolapse. So there can be, so this is a three things, anterior wall prolapse, it can be cystosil or it can be rectosil. Sometimes, now cystosil is also putting pressure over the vagina itself. So whenever the cystosil is there, it is an anterior wall prolapse. Whenever uterosil is there, it is a vaginal wall prolapse, isn't it? So it can be both or it can be only the vagina. Third is rectosil. So this is the rectum, which is the organ which is present at the back. So this organ don't have tone, or the ligaments which is holding the organ is weak, or patient has lot of voiding pressure and rectum is falling anteriorly. So rectum is falling from this posterior wall by putting pressure over the posterior wall. So this is what we are calling it as a posterior wall prolapse or rectosil. Okay, so from the posterior side, the pressure. Something is pressurizing me from posterior. So I'm falling like that as a vagina because pressure is there. So once you will feel your, insert your finger inside from 6 o'clock at the posterior part, you will feel some bulges there. And once you will press the bulge, patient will have a rectal sensation. So this is a rectosil or posterior wall prolapse. Once you will insert your finger anteriorly, 12 o'clock, and you might feel bulge. Now, where you are feeling bulge, up more deeper inside or downward. If the bulge is downward like a pipe, so this bulge is it can be urethrosil. If you put pressure, patient can feel urinal sensation, and you might feel leaking of the urine or some droplets coming outside. Because of the kinking, you are pressing the kinking of urethra. So patient can show you some urine leakage on the assessment table. Or if you are inserting your finger more deeper inside and you are pressing it anteriorly, the bulge is more deep. So that can be the bladder posterior wall. And if you press that, patient will give you that, yeah, there's the urinal sensations are there, bladder sensations are there. And if you press anteriorly, you might feel some leakage as well onto the assessment table. So cystosil, urethrosil, or anterior wall prolapse. Posteriorly, rectosil, rectal sensation, and posterior wall prolapse. So how many types of prolapse is there? Cystosil, urethrosil, and rectosil. Now, what is coming from the up? Up we have you can say the whole uterus, we are having this cervix. So uterus is falling downward. This is what we are, so we can see the cervix is very down. As soon as you insert your finger, you feel cervix. So cervix is completely very down, only within one knuckle, or it is outside also. Okay. So uterus is falling down. This is uterus. If uterus is not uterus, it is the intestines on the sides. So from the sides, some intestines are falling downward. So this is an antrosil. Not uterus part, it is an antrosil which is falling out. In small intestines, they are falling down. So antrosil. So antrosil will fall from up, uterosil will fall from up. So anterior wall prolapse, posterior wall prolapse, and from upper side, uterosil or antrosil. That can be a prolapse. It can be vagina is falling back or downward. Whole vagina is coming outside. So this is a vaginal vault prolapse. Okay, so this how there are 6 types of prolapse: cystocele, urethrocoele, rhabdocele, utrocele, antrocele, or vaginal vault prolapse. Clear, everyone?